This pandemic did not create inequities, disparities, or racism, but it has magnified the lethal effects of all of those.
So true.
We will only emerge through this public health crisis, this economic crisis, and this moral crisis if we demand that our American ideal of equity truly applies to each and every one of us. Dr. Redfield, the CDC website contains pages of information on disparate health outcomes for people of color, higher rates of asthma, heart disease, diabetes, to name a few. I understand from your answers to Congresswoman Lee's questions that tomorrow you will have an announcement, or later today, about mandatory demographic reporting. But wasn't it eminently predictable that COVID-19 would disproportionately impact Black, Latinx, and Indigenous communities?
You know, Congresswoman, I don't know, but it's clear once we understood that individuals with certain medical conditions were greater at risk, once we, stepped back and understood certain social factors in living conditions would be critical, I think it became rapidly self-evident.
Well, I can tell you it played out very, very quickly and evidently in my district. Yeah. And I think that is true across this country, and we have to do better. Your website also states that a lack of health insurance is one of the reasons that communities of colors face systemic health disparities, and in particular have been hard hit by COVID-19. Is it your professional opinion, then, that dismantling the ACA and the administration's proposed budget cuts of $1.6 trillion to Medicare and Medicaid could actually harm people, and in particular people of color in this country?
You know, Congresswoman, the way I can answer this is that I share with you the deep commitment that all Americans get access to high-quality health care, and that we effectively address access issues. I do know.
Do you think there is a way to address the disparities of health care in this country without expanding rather than reducing access to quality, affordable health insurance?
I think we clearly have to make sure that all Americans and expand the ability to get access to high-quality health care. The manner in which we do that, I'm not really here to comment on it.
I'm not asking you to comment on the manner. I'm just saying, is there any way, in your professional opinion, to address these disparities if we do not expand rather than contract access to health care in this country?
And as I said, I'm firmly with you that we need to continue to expand access to high-quality health care in this country for everybody.